Good afternoon. Good afternoon to you. Thank you so much for joining me here today. I am Senator Angela V. McKnight, and today is an exciting day. It's an exciting day, and I am so happy that we are here. An exciting conversation that we will be having, and I look forward to to being with all of you. And thank you so much for joining me. Women's History Month. This month serves as a reminder of the countless women who have paved the way for progress, shattered glass ceilings, and fought diligently for justice, equality, and dignity. Women's History Month is a time to recognize and celebrate the contributions of women from all walks of life, from trailblazers, leaders, and activists to everyday heroes whose names may not even appear in history books. It's a time to acknowledge the resilience, strength, perseverance of women who have overcome barriers and obstacles to make their mark on this world. Throughout history, women have played pivotal roles in shaping societies. Throughout history, women have done innovation. They are also champions of social change. Yet, despite the tremendous strides we've made, we cannot ignore the persistent challenges and inequalities that women continue to face. From having full control of our own body, gender based violence, and discrimination to disparities in wages and representation, that struggle for gender equality is far from over. This Women's History Month, let us recommit ourselves to the fight for gender equality and justice for all. Let us amplify the voices of women, support their leadership, and work together to dismantle the systemic barriers that lack. Let us celebrate the diversity, strength, and resilience of women around the world, from activists and advocates who are driving change to the mothers, the daughters, the sisters, the friends who inspire us all. As we reflect on the accomplishments and achievements of women throughout history, let us also honor the unsung heroes whose stories may have been overlooked or forgotten. Let us lift up their voices and ensure that their legacies are remembered and celebrated for generations to come. In closing, let us embrace the spirit of Women's History Month, a time to celebrate progress, honor their resilience, and recommit to the ongoing struggle for gender equality. Together, let us build a world where every woman and girl can live with dignity, freedom, and equality. Today, we are here for a virtual conversation navigating menopause with grace and empowerment. I am excited to have someone who is very knowledgeable on this topic. To be fully transparent, I just turned 47 years old, and I feel that menopause is about to knock on my door just as well for other women. Or menopause may be already knocking. I'm not sure. This is why we are here today. Let us get into this conversation. Today, I am joined with the beautiful Dr. Dineasha Potter-McQuilkin. She is a highly accomplished double board certified physician. She is an OB/GYN and a Menopause Society certified practitioner with over 17 years of experience in women's health. Recognized for her expertise in menopause management and sexual wellness, she has dedicated her career to improving the lives of women through comprehensive and compassionate care. With a deep understanding of the physical, emotional, and hormonal changes that women undergo during the menopause transition. Dr. Potter-McQuilkin offers specialized guidance and personalized treatment options to help her patients navigate this transformative phase of life with confidence and comfort. She is also a board certified physician in lifestyle medicine, enabling her to address the broader aspects of women's health by emphasizing preventative measures, healthy life choices, and evidence based practices. Through her holistic approach, she strives to empower women and promote optimal well being at every stage of life. She's not only enjoys empowering and teaching her patients, but also loves teaching young physicians and is a member of the teaching faculty at CarePoint Health Hoboken University Medical Center. Without further ado, please welcome Dr. Dineasha Potter-McQuilkin.
Hi, Senator. Hi. Thanks so much for that wonderful introduction. Wow. Thank you.
Thank you so much for being on here with me today. Thank you for saying yes to me today. I appreciate you
Of course.
so very much. So very
Anytime we
much.
can talk about menopause, I say yes, 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 yes. Let's talk about it. I think it's a very important topic, so I'm so happy that we're here.
Well, I appreciate you. So, I would like to ask you: do you have any words which that you would like to share about Women's History Month?
Yeah, well, certainly Women's History Month is very important. I'm so happy that we're celebrating Women's History Month and all of the accomplishments of women in the midlife period and throughout the lifespan in general. Women have made such strides, and we're making strides in this area of health as well. So it's very exciting that we're here.
Awesome. Thank you so much. I appreciate you.
Yeah.
And we are celebrating Women's History Month. So I read your bio, which is amazing, but I want to know, I want to hear from you.
Yeah.
Who is this lovely, beautiful doctor?
Yeah, so like you said before, I'm Dr. Dineasha Potter-McQuilkin. I am a double board certified physician, so board certified in obstetrics and gynecology, and also most recently in lifestyle medicine. And how I got into this area, because I'm also certified by the Menopause Society to become a certified practitioner, and I'm a sexual medicine physician as well. So how I got into this area was because I finished residency in 2010, and since then I've taken care of many women who were growing with me. So before you said certainly transparency, you're 40 or you're 47. I will be 46 in about a month, and my patients were growing with me, right? So they had a lot of these complaints, and they would ask for information and treatment options, which, to be honest, I didn't have any great treatment options for them. I would tell them what I learned in residency, which was certainly not extensive in terms of menopause care, but I found that I wasn't able to give them lots of evidence-based information to really optimize their health. So with that, I had to go back to find the information. I visited the Menopause Society, I went to their conferences, and I took their exam to become a Menopause Society certified practitioner. Now it's the Menopause Society. Previous to that, it was the North American Menopause Society. And so now I'm able to give them lots of information that's evidence based and have a real conversation as to what would optimize their health. And we'll talk about hormones and things like that later, but all to optimize their health completely.
Wow,
Yeah.
amazing.
Yeah.
So, the question that I have, and I know many others have, what are the stages of menopause?
Yeah, yeah. Well, that's certainly a great place to start because there's a lot of misconception around the stages. And you'll hear people say, well, I'm menopausal, I'm in perimenopause, I'm postmenopausal. So that's a great place for us to kind of open this conversation. So menopause is truly only one day. So it's really, one day in a woman's life. It's a year after your final menstrual period. And that would be the day, that's it. So after that, you're postmenopausal. And leading up to that, that's the menopause transition or what's called perimenopause. Right. In terms of the literature for perimenopause, you'll see it's noted more in terms of menstrual irregularities. So, premenopause, you can have a normal menstrual cycle, which will be 21 to 35 days. But in perimenopause, or when things start to change, when your hormones start to change, it can then be moved to 42 days, 60 days. You can have months between the period, and then you'll have a whole year and you'll be menopausal. So, does terminology really make a difference?
Mhm.
It doesn't truly make a difference all the time. You can say you're menopausal or postmenopausal, that's okay. But where it becomes more important is in terms of bleeding, because bleeding after that final menstrual period, that year later after the final menstrual period, when after menopause, that needs to be investigated. So that's really where, where it becomes key.
Oh, wow.
Yeah, yeah.
That's interesting.
Mhm.
Uh, yeah, the
Yeah,
stages.
yeah, because
So,
you'll hear menopausal, right, a lot.
yes.
Not so much, that postmenopause, but those
Mhm.
are the different, those are the different stages, yeah. And really in perimenopause, the menstrual irregularities that I just spoke about, that's how you know when you're in that stage, but you really feel like something changed, right? So that's when you know your body, something is going on differently. It might not always be the period, right? But you can't put your finger on it, but
Mhm.
you were going along, managing your stress, managing your weight, and then all of a sudden everything stopped and everything is becoming, overwhelming. Yeah.
So, like, what age does this typically happen, or is there an age group when this
Yeah.
happens?
Yeah. So the average age of menopause in the US is 51 and a half. So that's the average age for that year after that final menstrual period. But perimenopause, or the changes, can begin to happen 4 to 7 years before that. And in some ethnic groups, up to 10 years before. So we know for African American women, it can be up to 10 years before, and the symptoms can be more severe, right? So if we look at these ages, so 51 and a half is the average age, but the normal time span would be 45 to 55. So if you're 45 for menopause and 10 years before that would be 35, you could truly be in your late 30s and having a lot of these changes.
Oh, wow. So I'm 47.
Yeah,
And
yeah, yeah,
I'm trying to figure this one out.
yeah,
So,
yeah,
what are some, let's talk about the symptoms
yeah.
of menopause.
Yeah. So a lot of these symptoms occur in that menopause transition or perimenopause. So those
Mhm.
truly mean the same thing. And the symptoms, I believe last count, the symptoms were up to about 50, which is certainly a lot, right?
Mhm.
The most common ones you'll hear about are what's called the vasomotor symptoms, which would be the hot flashes, the night sweats. Night sweats will probably occur first because you can have a decrease in your estrogen in the evening. So those night sweats, but you can have anything from fatigue or anxiety and depression. So you can have those mood changes, difficulty concentrating, insomnia. Certainly that's a big one. Sleeping difficulties there.
Mhm.
Thinning of the hair on your head, but what's called rogue hairs on your chin. They just start to, kind of pop out. Yes, yes. The weight changes.
Crazy.
Yep, yeah, you can have those for sure. The weight changes. You could certainly
Mhm.
have bone loss, which is certainly a big one.
Mhm.
Digestive issues. So you really did become bloated before. Now lots of bloating, lots of diarrhea or constipation.
Mhm.
Heart palpitations is a big
Mhm.
one. Joint pain, frozen shoulder, and the list body, body odor changes, itchy ear,
Mhm.
dry mouth, dry skin, so there's a lot of changes that happens at this time. And vaginal dryness is a big one. And vaginal dryness, which could impact your sexual function, certainly.
Oh, oh, that's a lot. So when we go to the doctor, right? We have our annual checkup.
Yes.
Um, do we ask our doctor, or is the doctor willing to just give us this information?
Yeah, yeah. So certainly, I think it is something, especially if you're having, because these changes can be different for everyone. They might be mild for some, and certainly more severe for others,
Mhm.
and they can be debilitating for a lot of women. So it is certainly something that you should bring up with your doctor. Um,
Mhm.
Would your doctor necessarily bring it up during your annual exam? Maybe not, because I'm sure that you're aware in healthcare now you have a certain amount of time to get through all of the things, through the pap smear, mammogram, just check your lipids and things like that we do at that time. So they may not necessarily bring it up, but I think it is a good idea for women to let your doctor know that this is what's occurring, because you can always schedule a follow-up visit just to discuss those menopausal issues, right? Yeah.
Well, I have introduced a package of bills on menopause,
Oh, great. Yeah.
and one of the bills that I introduced is to have healthcare professionals to provide like a pamphlet and during a woman's annual physical exam. So a
Right.
pamphlet about menopause, because
Right.
sometimes, like when we go to the doctor, we're just going as our annual checkup, and we probably not saying to our doctor, I'm fatigued, or I'm always hot,
Yes.
right? So now I want the doctors to be proactive and give this information to a woman, so that
Right.
when they're home and they're reading this information, then they can be like, you know what, I think I'm experiencing this, so I'm
Yes.
going to do a follow-up with my doctor to talk more about what my body is experiencing. Because as women, right, we were able to birth, have babies, and now
Yes.
during this phase, and please correct me because I am not the expert, you are
Yeah.
doctor, and
Yeah.
with this menopause, then we're no longer able to have children. So can you just talk about that?
Yeah, yeah. So certainly all that you're introducing, I think, is very important, because that would at least open up the conversation. And I think lots of times we think what we're feeling might be normal. You may not even realize that this is perimenopause, because now I think there are a lot of people having this conversation, certainly like today. But before that, your moms didn't really talk about it. It was more taboo, hush, hush. You may not talk about this with your friends, so you don't know if this is normal. Are there treatment options available? Should I talk to my doctor about this? You may not be aware. So that's it's important for to have these kind of pamphlets, so they can review it and say, okay, maybe I should discuss this a little bit further. But you're right, in terms of menopause, the reason that you're having that final menstrual period is because you don't have there's a cessation of the eggs in your ovaries. So it basically stops, no more eggs, no longer producing those hormones, the estrogen and progesterone. You still have the hormone testosterone, because that's not produced only in your ovaries. You have production of that outside as well. But the ovaries that come primarily, the hormones that come primarily from your ovaries, there's a cessation of that. And so, yes, you can no longer have children at that point. But leading up to that, so in that perimenopausal period, because you have not yet had that final menstrual period, you can still get pregnant, which is what I speak to my patients about often, because that's their question, right? So I haven't had a period for 6 months, not yet quite that year. Can I still get pregnant? The answer is yes. So without that 1 year, you can still get pregnant. So if that's a concern, you certainly want to talk about contraception and things like that.
So say I haven't had my friend, I call it my friend, right? In 10 months, people
Yeah,
call it all different names, and I
yeah.
call it my friend.
Mhm.
So I haven't had it in 10 months.
Right.
And now this 11th month
Yeah.
comes, and
Mhm.
then I'm spotting.
Yes.
Does it restart the clock? Can you
Your
talk
clock
about
starts
that?
yep, your clock starts over again. Your clock starts over again. Yes,
Oh,
you
Lord.
have to start from scratch at the beginning. Yeah, yeah.
So
And
you
so
have to
because
have a full 12 months.
yes, yes. And so that's the definition. And it has to be not from another cause, right? So you can certainly have 12 months if you're in your 40s. A lot of times in that perimenopausal period, you may have heavy menses. We can use what's called an intrauterine device, or an IUD at that time. We can do procedures such as what's called the endometrial ablation, where you burn or freeze that lining. That will decrease your period. That can certainly stop your period. So we have to make sure it's not due to another cause. But generally, if you don't have any of those procedures, or you don't have that device, you're 45 to 55. Certainly, you're having the symptoms. That 1 year, after your final menstrual period, that will be menopause.
So then it's very important for women to like monitor their body, right?
Yes,
So
yes,
make sure, like, say if my friend skips this month, then I should be documenting it, to make sure that next month it doesn't come, or maybe it will come, because how would I, if I'm not paying attention,
Right.
then
you are certainly correct, because that diagnosis is somewhat retrospective, right? So I might not know that was my final, right? Until you had that year. So I think, which is why bills like this that you're introducing quite important, because you can have that conversation about monitoring your symptoms, right? Monitoring your symptoms, monitoring your menstrual period. What are you feeling during this time? Because when you come to the doctor, whether it be your annual or some other time, that would be the mainstay in terms of treatment options. What are the symptoms that you have, and how could we address those, right? So keeping track of all of that could be very important for you and for your doctor.
Awesome. Awesome. I also introduced a bill. Part of the package is to create an interagency council of menopause underneath the Department of Health. And this council will look at research, provide recommendations to promote healthy living with for women who are in the menopause. So I would love that, and I'm keeping an eye out on you, because I would love for you to be a part of that
I would love to be a part of it,
interagency. So let's speak that into existence. And I have another bill. If you're 40 and over, the doctor should give you information in reference to menopause as well. So I want to get the younger generation, where, like you said, it can start 10 years prior, all the way up to, the older generation, if we are, experiencing this. So, doctor, I have a question for you. What are some treatment options? What can women do with these hot flashes, and some people call them personal summers, and the itching and all of this stuff?
So certainly, yes, you're experiencing the 50 symptoms now. What do we do? What do we do? So that's where we are now. So certainly, whenever patients see me, I do what's called a 5-pronged approach. And this is where the lifestyle medicine, the lifestyle choices come into play as well. So in terms of my 5-pronged approach, we start with nutrition. So we want to make sure that we optimize that. Are you getting the key nutrients that you need? A plant-forward diet is certainly recommended. You can add your soy products here, which can have some positive effects on your estrogen receptors. You could certainly do that. Decrease alcohol intake, because that can make some of the symptoms worse. Caffeine intake as well, because that can also make the symptoms worse. So we want to discuss your nutrition. After that, physical activity as well. We want to get you moving. Certainly do the recommended 150 minutes of moderate intensity exercise weekly. That's recommended, but also just kind of starting from improving where you are. So if you're sedentary, you don't have to jump to that 150 minutes, but just move a little bit more, because that will help your sleep at night. That can help with weight management as well. So that's important. Sleep, we spoke about before how sleep can be affected at this time. So discussing the sleep hygiene is also very important. Are you getting those 7 hours? How can we help you to get those 7 hours of sleep? We discussed that. Stress management as well, because stress can increase what's called cortisol. And with that increase in cortisol, it can make your symptoms much worse, especially those hot flashes and the night sweats. So we need to address those as well. And then also hormone therapy. Hormone therapy is key here, because your hormones are decreasing. So that's really the reason why you're having a lot of these symptoms. So replacing those hormones could be very helpful at this time, the estrogen and progesterone. And certainly we can explore testosterone as well, especially if you have what's called hypoactive sexual desire disorder.
So I'm going to repeat what you said in my terms. Nutrition, moving, exercising, sleep, stress management, and hormonal therapy. Those are the way how you approach.
So I do that 5-prong approach,
which is holistic. I love it. It's hard to get a lot, the 7 hours of sleep. But you know what? I'm 47, so I'm going to have to make sure I get that in there. Decreasing, alcohol and caffeine intake. I like this. This seems, we can do this, ladies. We can do this.
And it's important, not just certainly for this period, because the menopausal symptoms, or some of them at least. So the hot flashes, night sweats, we spoke about how they can be 10 years. So certainly a long time, but for the majority of women, they will get better. 15% may persist, but they will get better for most women. Some of the symptoms like vaginal dryness, the bone loss, with treatment, that may not get better, but because the others will, it's not just the hormone therapy that we want to address, or the systemic hormone therapies. Not just that we want to address. We want longevity, right? So in women, we want to live longer. We want to be there for our families. And in terms of living longer, we don't want to be burdensome to our children if we have them. We want to be active, right? And be out there and do big things, contribute to, women. We want to be part of history, contribute to Women's History Month. All of that we want to do. And that would be keeping lifestyle measures at the forefront, right? So certainly doing that first, adding supplements and hormones if we need to, or if we choose to, but certainly the lifestyle is key.
So in reference to hormone therapy, do most insurance cover that, or is it private pay?
Yeah. So most insurance can cover hormone therapy. Some of them can get quite pricey, but for estradiol, which is generally the one that we choose, so that's what's called a bioidentical hormone. It's the ones that your ovaries make. There are generics for that. If your regular pharmacies that you may go to do not have them, they have some online ones that can help as well. Sometimes in terms of being the physician, I have to do a deep dive and see which ones we'll cover and do a little bit of work there. But for the most part, I get coverage. They can be pricey sometimes for the vaginal hormones. But again, we just try to do a little bit of legwork to see. I might be on the phone with the insurance company for a little bit, which can certainly become time consuming. But I work on, we certainly try to work on getting the coverage. Yeah.
Awesome. Now, do you recommend any type of reading that women should do in reference to menopause, like getting themselves more educated on this topic?
Right. Yeah. So to find good evidence-based information, the Menopause Society or menopause.org, that would be a great place to start. So they have what's on the website called Meno Notes, and it addresses the top issues or the symptoms in menopause and lets you know what you can do for that as well. So I think that's a great place to start. In terms of books and things like that, one of my favorite would be called Estrogen Matters. That's a helpful one by Dr. DipABLM. And it just talks about why estrogen matters, right? So why we should explore it. They talk about the studies in the past, so that WHI, and why it was a flawed study, because prior to the WHI, we had more than 40% of women on hormone therapy. And since then, it dropped to now less than 5%, right? Because there was a big scare for patients, not only for patients, but for doctors as well. So it really explores that in depth, and it gives you pointers for a conversation to bring to your doctor to certainly have great information, talk about your individual risk.
Now, are you taking more clients, doctor?
I am.
Listen, you right there in Hoboken. You not that far away.
I am in Hoboken. Yes, I certainly am. Yeah.
Awesome. So another 3 pieces, because I did a package of menopause. So for postmenopause, there's a postmenopause day national, and that day is October 18th. So I introduced a resolution so that we can celebrate that day here in New Jersey. And also the perimenopausal day is October the 11th. So I introduced that. And then there is a menopausal month. I did research, and that month is September. So I introduced a resolution on that as well, so that we can, talk about menopause during the month of September. We need to talk about this each and every day, but there is a national month. So I want New Jersey to actually celebrate that month as well. More awareness, more conversations, more education. For menopause. And for all the men who's watching, if you're watching now or you're watching later, I want you to have a conversation with your woman because we may be going through this menopause, and it is no harm to you. There's no harm to you, but I would love for you to have some understanding. Doctor, do you have any words to the men?
You know what? I certainly agree with having this, having that conversation, because one of the symptoms also mood changes and rage, right? So, they may say that my partner was great before, very calm, loving, I would bring something up, approach them, everything was fine, but all of a sudden it's like rage now, right? So having a conversation with the changes, I think is certainly helpful. This is what's going on, kind of be supportive as well. I think that certainly could foster a great relationship. Even going to the, you could certainly go to the doctor, with a partner, and hear the information. This is what's going on. This is what's recommended. How can I make some changes at home, right? To be supportive. I think that's also important. Yeah.
Now, do you recommend a conversation with our children?
Yes. So to talk about those mood changes and the rage as well. Yes, I think you should have a conversation with your children. The younger children obviously may not know exactly what's going on, but if you have older children, certainly older. If you have older girls, boys would be helpful as well. But older girls, so that they could know what to expect. They'll know what's going on with you, and to figure out how to support you. But for them to also know, when you get into your late 30s, 40s, 50s, this could be going on as well. You don't have to start from scratch with knowing, not knowing any information. I'm going to give you the information. You could certainly see and experience the symptoms that may happen, because you'll see what's going on. But I think that's certainly helpful as well.
Well, I appreciate that.
Yeah.
Is there anything else? Because I have a couple more questions, but is there anything else that you want to share with the audience about menopause?
Yeah, so I certainly don't. We talked about that WHI study briefly a minute ago. And that study, because it found an increased risk of certain things, mostly because they use synthetic estrogen and synthetic progestin in the study. There was a big scare for many women, certainly in terms of breast cancer and things like that. But a lot of that study has been walked back. And the ones that we use now are what's called bioidentical or biosimilar. So the ones that are similar to what your ovaries make. And because of that, we don't see that risk profile so much anymore. Also, there's what's called a timing hypothesis. And we know that if you start the hormones within 10 years of menopause and age less than 60, the benefits greatly outweigh the risks, right? So knowing what your symptoms are, because you certainly don't want to miss that what's called window of opportunity, knowing what your symptoms are, when to approach your doctor can be key. It can be key in terms of that timing and in terms of the methods or the types of hormones that you choose to get the greatest benefits, right?
So question, in reference to physicians, so you are certified in this.
Yeah.
So for a doctor who is not certified in menopause, are they armed with information that can like help a woman going through menopause?
Right. So I think that they may, similar to me, especially if it's an OBGYN, family physicians as well, especially if you're a family physician out of Hoboken University. I talk about it all the time. So you're certainly armed, right? So yes, I think if you're a physician, you may have had some introduction to menopause, but really to know the newer studies, the newer benefits, how hormone therapy can decrease your risk of heart disease by up to 40%, to know all of that information, what to implement and when, you really have to go back to get further information. Like I said before, the Menopause Society is really the best place to start. But what I recommend is, if you don't have the time to do it, or really the desire to do it, that's okay. Refer them, right? So refer them to someone similar to myself. In your area, go to menopause.org, find a physician, and you can find a physician to refer them to. Right?
Oh, wow. See, that's amazing. And also, with this, I'm going to speak it into existence, this interagency council that, they're tasked with what is needed to help women in menopause. Hopefully one of the recommendations is to, provide maybe a training to doctors or a resource to doctors so that they know. Because again, if you're a doctor and you specialize in one thing, if you know you have a or like you said, referral to a doctor who is specialized in another aspect, you can definitely refer. And I know a lot of doctors do refer, which is great. So thank you so much for that. Now, are you working on any particular project for menopause?
Yeah, so certainly we spoke about before in terms of getting coverage for meds, and that may take a little bit of legwork, but in terms of coverage for the menopause care in general, that can certainly be a little bit more difficult because we spoke about how the symptoms can be very extensive. You can have 50 symptoms, and to go through, some women have 2 of the 50, others may have all 50, right? So to go through that, the visit can be very lengthy. So menopause care coverage for the care for that visit may not be as great. So I'm hoping to implement what's called a group medical visit or group visits for menopause, because for 2 reasons, because it may help in terms of the coverage for the care, but also to just know that there are other women going through the same thing, right? So you're not alone. There's a support there, a sisterhood there that, okay, we're all going through the same thing. I'm not crazy. There are other women like me. I think it's helpful for that as well, because you can have that group setting, the support, but also you can break off into individual visits to see what's your individual risk in terms of hormone therapy.
Well, please sign me up. I'm signing up today.
Yes, certainly.
I would
I'm
love to
hoping
be
that,
signed
yeah,
up for that.
hopefully it makes a big impact, but yes, so hopefully you'll be there so you can see the impact that's going to make. Yeah.
Yes, I'm going to be a client too.
Right.
Please sign me up, doctor.
Yeah.
Doctor, this has been a wonderful conversation. I am leaving here with a wealth of knowledge that is going to help me in the next chapter in my life. And I hope and pray that people who are watching now or later, that this is going to help you. And if you are past menopause and you're listening, you may have a friend or a family member. Please direct them so that they can watch this video and hear all about the gems that Dr. McQuilkin gave us today. I am so elated that you came on to share your knowledge about menopause. Like you said, sometimes it is a little taboo, but we need to talk about this and not be ashamed of what is happening with our bodies, right? This is our body, and we know that in this climate, many are trying to take control of our body.
Of course, yes.
Right?
Yes.
However, this is our body. So we need to continue to hold that control and get educated as much as possible on what our body is doing to us.
Certainly,
internally.
Yes, because education is key. And the more conversations, the more platforms that we can use to have these conversations is certainly key to get the information out there, to let women know you're not alone. Other women are going through this. We're certainly stronger together. We're more empowered when we have the information. This was a very, very, very important conversation to have, especially in Women's History Month, right? That's just the icing on the cake. Yeah.
Yes, because we are celebrating Women's History Month. So if you are still watching and you have questions, please put them in the comment section. I will be following up with the doctor to get those questions answered. Again, the doctor is located in Hoboken, Hoboken University. She is tied to CarePoint Health. And she is a double physician and she's certified. So she has the knowledge and the wherewithal to help us. I appreciate you so very much for being here. Do you have any words left that you would like to share with everyone who is watching? I enjoyed myself. I have a whole list of notes. I'm going to be calling you, just let you know that, okay?
Of course. I just want women to know that whether you choose hormones or not, you do not have to suffer in silence, right? You do not have to suffer in silence. There is someone out there, certainly, like I said, the menopause.org. If you're local to Hoboken, Jersey City, I am certainly here, but in your area, go there to find a physician. You do not have to suffer. There are treatment options out there.
And on that note, the doctor said, you do not have to suffer alone.
Yes.
There is a whole group of people who are in this with you, including me.
Right.
I don't know if I'm going through this right now, but I'm going to do some more reading and I'm going to follow up because maybe I'm going through this peri. I don't know because my body's changing. And I'm 47, so it's coming. It's probably knocking on the door. But I appreciate you, doctor, for taking time out of your busy schedule to
Of
be
course.
here with
Of course.
me and to be here with the audience to share your knowledge on menopause. This is not the last time that I will be knocking on your door so that
Yeah.
we can help the community as much as possible.
Yeah.
We have post-menopause day, perimenopause day, menopause awareness day. So there's some works in the fire that I would love to work with you. And when
Yeah.
your group is up and running, you call me because I am signing up.
Certainly, certainly. Yeah. And I'm certainly excited to work together, on all of these. Yeah.
Well, thank you. And thank you and your entire team at CarePoint for allowing you to be here
Yes.
today and
You're
sharing
so
you,
welcome.
not allowing you, sharing you to
Yes.
be with me today. I appreciate you. And to all the audience who's listening, thank you so much for spending time talking about navigating menopause with grace and empowerment with Dr. Dineasha Potter-McQuilkin.
Thank
Thank
you.
you, and you
Thank you very much.
have a blessed day, everyone.
Yeah. Bye-bye.
Happy Women's History
History.
Month
Yes.
again.
Bye-bye.
Bye-bye.